Yeah.
Hi, everybody. So first of all, it's nice to be back. I got privileged to visit Sardinia, which is a beautiful blue zone. Those of you who don't know what blue zones are, those are the areas where people exceptionally frequently live to the age of 100. I did visit one of such villages with a population of less than 10,000. They have 11 centenarians. That's a pretty crazy number. It's basically it's more than 1 per thousand on average. I think most of America's, we're not getting 1 to 100,000. We're somewhere between 1 and 200 to 1 to a million in terms of people making. So it's like dramatic difference. I mean, we're talking 1,000-fold more prevalence compared to some parts of the world. So if you're interested about this topic, definitely check it out. Just Blue Zones, wonderful topic. At some point, we should actually do a whole wellness talk based on that, but I don't think we're going to have time today. So, and then I'll give you two news. So one is a COVID news, kind of all over the place. Those of you who've been following the whole Ozempic and all the semaglutides saga, hoping that somehow they're going to be a part of the COVID treatment. Unfortunately, they're not. So this is a negative. Two large controlled trials showing there's no role for those medications in decreasing severity of COVID in any situation. So unfortunately, even though you'd expect those drugs to have some efficacy because prior studies have shown if you control glucose better during acute COVID, there are better outcomes. Like there's some hints that metformin may be beneficial for some patients with acute COVID, but it's surprising that it didn't pan out. But nonetheless, that's the news. And then the second big news is, of course, the Marburg virus. You do have to keep an eye on this. This is probably the largest threat since COVID for sure. As I mentioned before we started, the government is on the highest alert. There are suspected several cases. This is not actually you're going to find in the news right now, but there are several cases of transmission to the US already. So government is trying to do something about it. The problem is that with mortality about hovering between 50 to 90%, if this starts spreading, this would be a pretty scary situation. There are no treatments. Marburg virus is very similar to Ebola in manifestation, except that it's much, much higher mortality. Ebola has mortality of about 20 to 40%. This is at least double the mortality. So basically no one will survive if pandemic happens, or very few people. This will wipe out, 70 to 90% of the entire population within a few weeks. The problem is that it's very hard to trace transmission, and the incubation period is very long, it's several weeks. So you could pick it up somewhere and not knowing and moving. So right now it's still death cases are limited to Rwanda only, but the transmission has already occurred around the entire world. So we are expecting mortality start showing up in every country very rapidly. So it's a Marburg virus. It's spelled, should put that in the chat. Marburg. It's actually not exactly Ebola. It's a I don't want to bother you with sort of taxonomy. It's not important. But in terms of clinical manifestation, it's very similar to Ebola. It's something what's called a hemorrhagic fever, or hemorrhagic viral fevers, where you start having high fever, malaise, flu-like, but then people bleed out from every orifice, and there's very little that can be done against this. So yeah, so we don't know what to expect. That's the problem. We don't know how. We know it's spreading by direct contact, but because incubation period is so long and people become infectious before they show symptoms, it's not really clear how you're going to prevent this. In fact, there's no understanding on it, except that complete isolation and like aggressive isolation and very prolonged isolation for those who've been exposed up to months. And that's obviously very difficult to achieve. So I will be keeping you on updates as things evolve. Again, for now, the reason I'm spending so much time on this is because it could end up being something horrendous. And the sooner we start preparing, the better. But I hope that this conversation is empty. It will never show up here. remember, I mentioned there are cases of exposures and all people who were exposed moving across the world. That doesn't mean that those people are going to get infected, right? So the exposure was not equal to infection, and it's not really clear exactly what percent of people who are exposed end up being actually sick. So that's sort of the short of it. Let's turn to the questions. I know a lot of you probably have COVID vaccine questions. Maybe you have some other questions, but you know the drill. Put the questions in the chats. In the chat, if it's easier, just unmute. Go ahead and unmute. Other than that, I'll wait for questions. And if there are no questions, I have a number of things I can bring up, but I rather, since like there are a lot of questions, I rather we do questions first, and then we'll see where we end up. Cynthia, how much time do you want? Half an hour? Okay. About 20 minutes here. Okay, while you guys getting all this organized, my ADD is speaking, so I'm going to give you some other information. So those of you who have been following our YouTube channel, there's very successful lecithin video, so I figured some of you may be interested in it. Lecithins are, sorry, not lecithin, what am I saying? Lectins. Lectins are type of a protein that actually binds to carbohydrates, and there's been this big controversy. There are some experts like Dr. Gundry who claims that lectins are the biggest harm of all of the food and nobody should be eating them. And then, of course, there are experts who are saying this is total rubbish. Our body makes lectins. Lectins are very important for our life. And so sort of how do you tease out what's truth and what's not true? I will tell you, half of what Dr. Gundry ever said is complete baloney. It's just to attract people to buy his products. But there is still some interesting points of wisdom in what he says, but I figured I'll give you the link, so go check it out. It's about a 25-minute video. All you ever need to know about lectins. In short, they could have some role in your health. Most likely they're not, and most likely you don't need to worry about that. And that's all I'm going to say about that. All right, still no questions. All right. Okay. No, actually, Dr. Gundry is aggressively saying don't eat them. And how to eat them, it means how to cook food so that you don't get lectins. Is a lectin free. It's like basically nobody should be eating any piece of lectins. All right, I see that Linda had a question first, and then I think Jennifer had a hand up, so we'll do it in that flow. Okay, how did the virus transmission start? You're talking about the Marburg. Okay, yeah. So Marburg is a classic zoonotic virus, so it has to come from animals, and in this case it's bats. I'm pretty sure. So people get in contact with bats. Bats are carriers. They don't die from this virus. It doesn't bother them actually. But if you come in contact, then you get sick. And typically it's a rare virus and transmission, and it occurred in the past few times. So this is not a first epidemic. And with Marburg, since mortality is so high, even one case is considered by default an epidemic. So right now there are a total of 11 deaths, which is the highest number ever occurred from this virus. It's usually very small because, it would start out from people who go to caves, who spend times in caves where bats live, and then they get either excrement of the bats on themselves somehow, or just get bitten, or whatever. And so how this one started, I don't remember. I don't know. Presumably from bat, but at this point, the problem is that most people who died now, they're all healthcare workers. So they were the people who in ICU took care of the sick patient before the Marburg was identified. They just presumed it was a regular, some kind of severe flu, but it wasn't. And then all these ICU nurses have died who came in contact with this first initial patient. Okay, so Jennifer typed her question. My question was how to handle the diminished immunity after latest vaccine. Any data on how long a vaccine you can relax masking, etc. Okay, So remember, the vaccines in the past have failed to block the transmission. So masking or no masking has nothing to do with the vaccine. Okay, so let's just separate those two because it's important. You should still be masking in heights of the, like in certain situations where ventilation is poor, if you want to. I mean, if you feel uncomfortable, that is. Obviously, if you go around, and I was just traveling and nobody masking anywhere. I haven't seen a single person masking in Europe. I have seen few people masking on airplanes here and there, but it's very few people masking, period. Doesn't mean you shouldn't be masking. Okay, and then so the expectations are, if we're going to follow the logic of a prior vaccine and the vaccine lasting for somewhere between 3 to 6 months and an actual strongest protection and minimum amount of transmission during that protection. But after that, you still protected for a long time against severe illness. Exactly how long, that's hard to say. I mean, it could be forever, actually, and the boosters are really just decreasing further severity, decreasing chances of long COVID. That's their value more. But I presume that it'll be not as long acting as the original set. So if we're going to follow what happened with the last couple of boosters, I'm going to presume that the CDC will not change recommendation of boosting people every 6 months if you're at very high risk, and once a year for those who are at the lower risk. I'm guessing they're going to keep it that. So basically, this is all heading towards flu-like recommendation in essence, except if you're a very high risk category, like the cancer, for example, or transplant patient or patient on immune suppressants, then you may opt to do it twice a year instead of once a year. Is that good enough? Okay, any word now on the flu season might start? No, I don't actually have. That's a great question, Cecilia. I don't think we know. So far, we're not seeing it yet, which is probably good, but we're just at the beginning of October. Remember, I think I mentioned that many times that we're generally not seeing flu coming till around mid to late October. And that's the typical expectation. That's why I'm saying, if you still haven't gotten your COVID shot, go ahead and get it now, and then get your flu shot at least 2 weeks later. That's what I'm telling everybody. And if you're wondering why, I'm just going to remind you, because combining COVID and flu vaccine has caused a significant excess of strokes. And that's been even acknowledged by CDC. It's been acknowledged by every major society. And so while general statement, the risk is very low and you can safely combine the vaccine, I disagree completely. I think you should really separate the vaccines and get either one first, but since we're more in the COVID territory still and less in the flu, you should get COVID first and then flu. So with that. Okay. All right, I think that answers Cecile's question, hopefully. By the way, just a reminder, if you're over 65, you should be getting a high potency vaccine against flu. There are at least 2 of those, both available in a single vial as well as in multi-vial. Multi-vial will have a small amount of mercury, as a mercury salt. If you don't want that, please ask for single-use vial or just for single vial preparation. And any pharmacy must comply with your request. If you don't trust them, literally ask them to show you the vial so you could read the ingredients if you really like. They say, why? They say, well, my doctor told me to check to make sure there are no ingredients to which I'm allergic to or something in those lines. Generally, I have not heard of the pharmacists refusing to provide such a response or such an information, or sort of lying to people and administering. Multi-vial use is way cheaper, but both are covered. So all vaccines are covered under insurance. And of course, the pharmacy is going to try to push to give you the cheapest one because they're going to make higher profit on that. But remember, you can totally request single vial and they will comply, as I said. Late as possible. Correct. So Cecilia's right. This goes to a little bit different point. remember I said that the flu vaccine, just like COVID, doesn't last very long. So it doesn't really last 6 months. It lasts reasonable protection, lasts for about 3 or 4 months. So if we end up with a prolonged COVID season, and let's say you're still at risk in April or May, the COVID shot, if you got it in August, for example, is basically you're already zero protected at that point. Now, that is, of course, if we have a long flu, and if we have, and if you, for whatever reason, gotten the flu really, really early. So if you get a flu shot now, let's say you get flu shot October 1st, right? If you add 3-4 months to that, you will be covered for the highest flu season. So just FYI. That's why I usually suggest getting sometime in October. Now, if you push it further out, I mean, you're going to start risking getting it, right? So if you push it to November or December, there's a chance that you may get it in late October or early November. So that's why you have to decide on the timing here, and it's not all that trivial how to pick that. That's why this question comes up every year. All right, we still have a couple of minutes here, so I'll wait for more questions. Okay, while you guys deciding, if you have more questions, let me put another link here. So this is the most recent video I just did, and this one talks about this new biological markers for Alzheimer's disease. So if you're interested in this topic, check it out. Basically, the question goes like this. If you think you may be at the risk for Alzheimer's disease, should you do about it? What should you do about it? Should you basically assess something to double check whether or not you're at risk? And that's the idea. So in this article, I reviewed the recent study showing that some of these markers, particularly this p-tau markers that are new but already in clinical service, they're predicting development of Alzheimer's as far as 25 years earlier. So that gives us a tremendous timing opportunity, and the tests are very low cost and they're covered by all insurances. So it allows us to say, if I'm at risk, I have a family member, maybe I did my 23andMe for no particular good reason, whatever, and then it's picked up that you have an ApoE4 gene 1 copy. So when you know your risk is more than average, it's definitely a very, very important thing to consider. So check out the video. It may actually do something for you. Literally, it may just pick up something that you need to address. And the good news is now that we have those preventive protocols and they're highly effective, it makes sense because, preventing Alzheimer's or preventing dementia is way, way, way easier than the treating one. So that's why I think it's a very important topic, and I wanted to bring this up. Yes, it's a lot more telling than ApoE4. Apo doesn't tell you much of anything except that you're at risk. It doesn't actually tell you that you're going to get it. Apo is a simply genetic marker. The problem with any genetic marker that you don't know whether that genetic marker applies to you accurately. What do I mean by that? Let's say that you have 1 copy of ApoE4. So the general population risk for someone with 1 copy goes from about 15-20% risk in life to develop Alzheimer's upwards to about 40-50%. It seems like it's significantly increased risk. That is true. But you still have more than 50% chance of not getting it, right? And so how do you figure out which percentage are you going to end up in? This test 20 years ahead will tell you that 99% chance you will get Alzheimer's 20 years from now. So they're actually literally markers that you already have Alzheimer's process occurring in the brain. You just you don't have symptoms yet. That's the problem. So the clinical question of Alzheimer's, it's a clinical diagnosis. It's not really biological or molecular diagnosis. It's a diagnosis that you have a problem. So if your cognition is a certain place you have certain manifestation of disease, like you can't remember things, you struggle with language, you difficulty operating, budget and whatever. So those are the clinical features of a disease. The problem is, how do you separate that from, I left, I can't remember where my keys are, where I put them, right? I'm younger than probably most people here, and I do this all the time. Like, where did I leave my keys? My wife probably gonna do, if she's ever gonna divorce me, is over that question, that I always complain that somebody took my keys. But that's a classic attention deficit disorder kind of symptom. So, there's a lot of overlap. You could be depressed and forgetting things. You may have woke up after a really bad night of sleep and you're forgetting things. But how do you practically separate all that noise from, okay, that's a real potential serious case of Alzheimer's that's going to happen in a few years? That's the beauty of this new tests. Basically, they're looking for plaques and tangles proteins in the blood. And they basically exactly, this is a great question there in the chat, everybody take a look. So it is just a simple blood test. It is no longer a spinal fluid. And if we were to talk about spinal fluid that was predicted to be most effective tool, the problem with spinal fluid, you really cannot once a year or every other year get the spinal fluid tap. It's not a simple procedure. it has some risk. You actually can have very serious risks if you have infection going through that needle that goes in the spine. You're going to end up with some really horrendous complications. They're very rare, but they can happen. So in short, it is simple blood test covered by all insurances now. Your doctor will need to know how to order it and how to code it so that you don't pay out of pocket for it. Out of pocket, they're not cheap. There are some companies that offer it out of pocket. They're charging a lot of money. Apollo, that's a Bredesen company, they're, I think, offering a bit more sophisticated way of testing for about $800. You can probably get this test for about half of that if you pay out of pocket. But as I said, they are covered. So far, we haven't had any problems ordering these tests on anybody at risk or at anybody who has cognitive impairment and getting insurances paid for this test. So I'm at 25 minutes. I feel like to see if there's any last question, and then I'll just I actually covered almost everything I wanted to cover. But we'll do blue zones in some other day, for sure. All right. Well, Cynthia, thanks so much for coming. Wonderful always to have you. And take the lead.
Okay, thank you, Misha. I'm so delighted to be here with you all. It's been a little while. For those of you who may be new to meditation and mindfulness, I'd just like to share some foundational information before we move into a practice. For some of you, this is likely a refresher. But just defining meditation, the definition I'll share with you is from the National Institute of Health. It's a mind and body practice that has a long history of use for increasing calmness and physical relaxation, improving psychological balance, coping with illness, as well as enhancing overall health and well-being. Mindfulness is a form of meditation, and the definition of mindfulness I'll share with you is from Dr. Jon Kabat-Zinn, who developed the mindfulness-based stress reduction program, which I know some of you are familiar with. So mindfulness is the awareness that arises by paying attention in the present moment on purpose, non-judgmentally. Another way of viewing this is paying attention to our thoughts, our feelings, our body sensations, as well as the environment around us without harmful judgment. So there are many benefits to engaging in mindfulness practices, as many of you are aware. And what I'd like to share with you today is actually a body scan practice. So in the body scan practice, you could either be lying down or sitting or standing, whatever your preference is. You want to be in a comfortable position, yet you also want to be alert. So I'll just give you a few moments to move into your preferred posture. Again, you could be lying down comfortably, remain seated or standing. And the body scan meditation practice really consists of moving our attention through the body. So bringing awareness to any sensations that are present, and that can also be felt moment to moment. So, along with attention to sensations, you may also be noticing emotions or thoughts rising as you engage with various parts of the body. And being aware with how thoughts and emotions are with the body can really be a reawakening of sorts to the connection of mind and body within your being. So, by taking part in this practice, we're involved in cultivating a stance of curiosity, a stance of friendliness toward our really our entire experience of being alive. So, please keep in mind you don't need to push anything away, nor do you need to make anything particular happen during this practice. The focus is on any intention that you may decide to set for yourself during this practice, as well as the importance of consistent practice. So, if as you practice, you come to areas of physical pain or mental agitation or difficulty, please know that you always have a choice about where to direct your attention. So, you might choose to lean in with curiosity and explore what's here if it feels appropriate and accessible. Or you might prefer to move the attention to a neutral location and then return to that specific part of the body if and when you feel ready. So it can be very helpful to establish what we refer to as a neutral home base where you can always rest your attention. So when you have a moment where you need to bring your attention to a neutral base or a neutral focal point to feel a little bit more grounded and settled, please trust yourself to make the best choice for yourself in that moment. Similarly, if you become physically uncomfortable at any point in the practice, you can choose whether to explore the sensations of discomfort with some curiosity, or you might choose to make a choice to shift your position, and either choice is fine. If you decide to shift your position, the invitation is to simply do so with awareness. So, again, taking a moment to get situated, settling into a position where you feel comfortable and alert as well as receptive. Being aware of the body in this moment and any limitations you may be experiencing. In whatever posture you've chosen, just releasing your weight gently onto the surface that's supporting you. You're making any adjustments so you feel supported and grounded as much as you can, as much as possible. And the invitation is also to close your eyes or gently lower your gaze if you feel more comfortable. One of the benefits of closing the eyes or lowering the gaze is helping with the mind body connection, as well as removing any possible distractions visually during the practice. Now, if you're feeling tired, a little sleepy at this time, you may decide to keep your eyes open, and this can certainly support alertness. So, as John Kabat-Zinn has said, a focus of the body scan practice is actually falling awake. Starting to sense the orientation of your body and the space that you're in, feeling places of contact between the body and whatever is beneath you, whatever's supporting you. Noticing what you feel in this moment. You might be sensing pressure or firmness, maybe softness or temperature. You may be feeling sensations on the outside of the body and within the body. And these sensations may be strong or subtle. And in some areas, there may be an absence of sensation. That's okay. So you're just encouraged to be curious, letting the attention simply rest. Also, the invitation is take a moment to notice any areas of clenching, perhaps places where you might be holding on tightly. And if so, seeing if you can soften, letting that happen to the extent possible. And if it's not possible to soften any areas of tightness or tension, just letting these sensations ebb and flow on their own. And again, during this practice, noticing any tendency to evaluate or judge yourself. And if that's happening, See if you can allow things to be exactly as they are without any need to fix or change anything. Again, inviting the attitude to be welcoming and friendly, as well as curious. And you might like to set an intention for this practice. So, tuning into the area of the heart, perhaps, maybe even putting one hand on your chest over your heart, just checking in, asking yourself how it is that you would like to show up for this practice. And now letting the attention come back to the entire body, feeling places of contact. And the invitation is to bring your attention along the left leg and letting the awareness come to rest wherever the left foot is making contact with whatever's beneath you. That might be the floor or a mat, couch. And as you're ready, begin noticing the sensations in the left foot, beginning with the sole of the foot. And bring awareness to whatever you feel at the heel, the arch, the ball of the foot. There may be tingling or there may be pressure. Perhaps you're sensing some buzzing or pulsing. Perhaps you feel numbness or just an absence of sensation. Just tuning into what is experienced in this moment. And then gradually guiding your awareness to the toes of the left foot, top of the toes, between the toes. And bringing awareness to sensations on the surface of the left foot, as well as the sensations within the body. Now gently shifting your attention to the left ankle, and noticing what's present. And widening the attention to take in the entire left foot, aware of its volume, aware of its shape, whatever you may be sensing about the entire left foot. And now moving attention gently up the lower left leg, the calf and the shin, feeling whatever's here. You may be sensing air or a fabric touching the skin. Perhaps there's a pulsing sensation. There may be ease or difficulty in this part of the body. So again, the invitation is hold whatever's here with kind awareness. And gradually letting the attention come to the back of the knee, side of the knee, the kneecap. Again, tuning into sensations in this part of the body. And bring your focus to the upper left leg to include the thigh, quadricep, hamstring. Really sensing the larger muscles of the leg. And guiding the awareness of the hip on the left side. And when you're ready, widening the attention to take in the entire left leg, from the hip joint to the tips of the toes. Just resting the attention here. Feeling sensations as they may come and go. Also letting thoughts and emotions arise and fall on their own. And if you've noticed that your mind has wandered during this practice, it's inevitable. It's very normal. Just noticing that your mind has wandered and bringing your focus back to the attention, whatever you're focusing on, is a form of mindfulness. So it's important when you notice that your mind has wandered again, which will inevitably do, gently, firmly bringing your attention back to your focal point. So gathering the attention again and bringing the focus back to the left hip, coming across the pelvic bowl and then down the right leg. And letting awareness come to rest at the sole of the right foot. And as you're ready, letting your attention move along the sole of the right foot, tuning in the sensations in the heel, in the arch, in the ball of the right foot. Bring your attention now to the toes, between the toes, top of the toes, tuning into whatever is present here. Taking a few moments to sense into the weight of the foot, the shape, the volume, sensations on the surface and also within. And bring your attention now to the right ankle, circling your ankle with awareness. And guiding your attention up the lower right leg, sensing into the calf and the shin. Aware of muscles, bones, nerves, tendons, ligaments, whatever is present here. And now letting your awareness come to rest at the back of the right knee, sides of the knee, the kneecap. Being aware of sensations as well as thoughts and emotions that may be arising. And now directing attention up into the upper part of the right leg, tuning into whatever you feel here on the surface and within. And guiding the attention up to the right hip and sensing the hip connecting to the torso. And as you're ready, widening the attention to take in the wholeness of the right leg from the right hip down to the right foot, to the toes. Just resting your awareness in this part of the body. Noticing where the mind is, aware of any judging or striving. Now guiding awareness back up to the right hip and moving awareness into the pelvic region, the pelvic bowl, side to side, front to back. As you're ready, bringing your attention to the back side of the torso, bringing the awareness to the tailbone. Now gradually bring the attention up the back, sensing whatever you feel here. And once you've explored the lower back, continuing to guide your awareness up to the mid back. Perhaps noticing the beginning of the rib cage. Maybe sensing the expansion and the contraction of this part of the body with the breath. And continuing to move your awareness up the back, coming up to the shoulder blades, the upper spine, the underarms and the shoulders. As you're ready, bringing the attention to the front of the torso, starting again with the pelvic bowl, guiding the awareness to the front of the torso. So sensing the abdomen, continuing up the torso to sense perhaps the ribs, and sensing the sides of the torso as you inhale and exhale. Now tuning into the lungs and the chest, sensing the collarbones. You may even be aware of the heart beating. So bringing awareness up to the shoulders, feeling whatever is present here. If there's tightness or tension, constriction, seeing if you can gently soften. And now the invitation is widen your attention to take in the entire torso exactly as it is. From the shoulders to the pelvic bowl, front to back and side to side. Tuning into all of the life activity that happens in this part of the body. And again, noticing where your mind is. And as you take this time to sense into your body, acknowledging that things have changed over time and holding whatever is here with kind awareness. Now moving the attention up to the left shoulder. As you're ready, guiding the attention down the left arm, exploring the upper arm, resting the attention at the elbow, continuing the awareness down the left arm to the forearm, gradually to the left wrist. And perhaps you sense a gentle pulsation here. And as you're ready, guiding awareness into the left hand. So tuning into sensations in the palm of the hand, the back of the hand, as well as the fingers and the thumb. Noticing any sensations that are arising. Now bringing your attention to take in the entire left arm from the left shoulder to the fingertips, the volume, the shape of the arm, the hand, the fingers and thumb. Gathering the attention and bringing it back up to the left shoulder, sensing into the collarbones. And now beginning to explore the right shoulder and the right arm. You're moving your kind awareness into the upper arm and beginning to explore the different layers in this part of the body. Just feeling sensations as you move the attention down to the elbow, down to the lower arm, the forearm, and letting your attention come to rest briefly at the right wrist. And moving the focus of attention to the right hand, exploring what you feel here. So tuning in the sensations in the palm of the hand, the back of the hand, the fingers, and the thumb. Again, noticing the sensations on the surface of the body as well as within. And now bringing your attention to taking the entire right arm from the fingertips up to the shoulder. Sensing the entire right arm exactly as it is in this moment. And now gently releasing the focus on the arms as you bring attention to the neck. Sensing the neck supporting the head and connecting to the torso. Letting awareness come to rest at the back of the neck. Again, noticing sensations on the surface and within. Coming to the sides of the neck. Perhaps bringing awareness of the muscles in this part of the body. And moving the attention to the front of the neck. Sensing the inside of the neck. Aware of the throat. Now guiding the attention up to the head, sensing the chin, the jaw, the back of the head, sensing the base of the skull, and whatever sensations are present in this moment. And so guiding the attention to the back of the head, letting the attention more gradually feel whatever is here. Guiding the attention to the sides of the head. As you're ready, tuning into the temples and the ears. You're turning your attention to the chin and starting to explore all the sensations in the face. So perhaps guiding the attention up to the mouth, aware of the lips and also all of the surfaces within the mouth, the teeth, the gums, the tongue, roof of the mouth, back of the throat. Just lingering here for a few moments, noticing what you feel. And guiding awareness to the cheeks, moving your attention to the nose, including the nostrils, feeling the touch of air on the skin. And continuing up to the eyes. Oh. Sensing the eyelids, soft tissue around the eyes, the eyeballs, bringing attention to the eyebrows, and gradually moving awareness to the top of the head, the crown of the head, letting the attention rest lightly here. And as you're ready, expanding the attention to take in the entire body, from the crown of the head to the tips of the toes. Feeling the connection as you bring your lens of awareness to the entire body, exactly as it is. Aware of sensations as well as any thoughts and emotions that are arising. So beginning at the crown of the head, bring your awareness to the neck, connecting the head and the torso. Bringing the lens of awareness to take in the entire torso, from the shoulders, down the back, and the front, and the sides, all the way down to the hips and the pelvic floor. Sensing the arms from the shoulders to the fingertips. And widening the lens of awareness again to take in where the torso meets the legs. And sensing this part of the body, from the hips down to the knees, down to the ankles and the feet. Noticing the changing flow of sensations in the body. Noticing that sensations change moment by moment. Thoughts may arise and pass on their own. Emotions form and they fade. And sounds come and then they may go. And if it feels appropriate to you, you might like to express some appreciation for your body with all its abilities, all of its limitations. You also might like to express some appreciation for yourself for taking this time to nourish your own well-being by offering yourself your own kind and gentle attention. So the invitation is to now reintroduce movement to the body. So you might like to start by wiggling your fingers and toes, perhaps rolling hands at the wrists, your ankles, perhaps in one direction then the other. If you've been outstretched on your back, you might like to pull your knees in gently toward your chest and gently rock from side to side. Just taking a few moments to tune into your body. Perhaps stretch in a way that feels supportive to you right now. And gradually opening your eyes if they've been closed, letting in light and shapes and color. And as we bring this practice to a close, the invitation is to bring this level of awareness throughout your day. Thank you.
Thank you, Cynthia. That was wonderful. Has your voice always been so soothing?
I'm not sure about always. But thank you, Janet. That's very kind.
You're welcome.